Hi there, I'm Dr. Jordan Metzl, and I'm here to talk to you about a really important topic, which is shin splints. Now, many of you runners and triathletes get shin pain all the time, and I get a lot of calls in my office, my shin hurts, or the people come in, my shins hurt. How do you know what the bad kind of shin splints are, and how do you prevent them? Well, there are two main kinds of shin splints: bone-related shin pain, which is about 90% of shin splints, and muscular shin pain, which is about 10%. Now, the most common bone-related shin pain happens when the bone actually starts to swell. And what happens is if your foot rolls into the middle or pronates, you start to load too much pressure on the inside part of the bone, and the bone can get really irritated and sore. Over time, that can turn into what's called a stress fracture. So my main advice for your bone-related shin pain is if it's starting to hurt, make sure you get it checked out. And then the other important thing is, how do we prevent this bone-related shin pain? And the way we do that is to, first of all, get a running shoe that prevents pronation. So a motion control shoe that prevents the rolling in will help you a ton. And the second thing is talk about getting an orthotic. Now, you don't need to spend $1 million on a custom orthotic. Some of the $25 orthotics that have a hard arch on the bottom are just as good as the many hundreds of dollar ones. So start with the $25 one, do yourself a favor, and that should help a lot also. Now, the other part of shin splints, the muscular kind of shin pain, is about 10%, much less common. That's called exertional compartment syndrome. And that happens when the muscle on the outside part of the shin tightens up when you start to run. And when that happens, you get this tightening feeling in your leg. And if you're getting that kind of shin pain, you have to talk about it with your doctor, and you sometimes go to get a massage therapist to loosen up that muscle. And if that muscle is loosened, that kind of shin pain can go away. Rarely, exertional compartment syndrome needs surgery, but most often it can be fixed with some good physical therapy and massage. So if your shins are aching, make sure you get it checked out and we can figure out what to do about them.